We're going to be going over hamstring injury tests now. The first one, by the way, I'm horrible at saying it, is the Puranen-Orava, I believe. And the way that you do this is really just a regular hamstring stretch. And so what they would do is swing their leg up, ideally getting their hip flexed to 90 degrees with their knees straight. And in general, supposedly if they can't do this, they have a torn hamstring or some kind of strain. But I will tell you, lots of people cannot do this because one, it depends upon the height of the table, but two, it depends upon their flexibility. You can put it down. Because there's lots of people who feel like they're gonna tear their hamstring, come on up here, tear their hamstring when they're in that position just because it is so stinking tight. The next one we're going to do is the bent knee. And when you perform this test, you need to make sure that you are moving their legs slowly. If somebody actually has a hamstring strain, they're going to be guarding a lot. Remember, it's muscle contraction in relation to an injury and pain. So if this leg was hurt, what I would do is I would maximally flex her hip as far as we could, and then I'm going to take the heel of my hand and her heel and slowly extend up her knee. And then when she reports pain, that's when I stop. You should not be taking it past the point of pain. If they have some kind of discomfort or regular just hamstring tightness, that's one thing, but again, you're gonna be comparing bilaterally. So if the unaffected leg can go all the way up and the affected leg can't even get all the way to 90 degrees without them screaming pain, that is going to be a positive test. But don't expect people to be a ballerina and get their foot up by their head when you're doing this test. Because again, most people don't have that kind of hamstring flexibility, and you're not trying to hurt them worse by doing these special tests. The other test is the modified knee bend test, and I'm going to tell you right now, I'm not going to put her through this, and I don't actually recommend ever doing the modified test, because in general, you do what I just did, but you do it super fast. So if somebody has a hamstring injury and they just probably strained it by going through a max fast contraction, you are now putting them through the exact same mechanism by doing the special test, and you might actually make the injury worse. At the very least, your patient is going to be super pissed at you and not trust you and never let you touch them again, because you probably just inflicted a ton of pain on them. I don't know who came up with that test, but it's a terrible test, and I would never ever do it. I'm just throwing that out there for you as a clinician. The last one is to take the shoe off test, and I don't think that there's any point in us showing that, because literally you're just taking one foot and using the other to pull their shoe off, and if it elicits pain, that is a positive